Oh, whoa. Wow. It's literally like you just stretched me and put me back together. I don't know how to explain it. It's just, it feels amazing.
Right. Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now she's primarily experiencing low back radiating pain down her left leg, and then some tension along the traps, kind of going up into the up the neck as well. Right?
Yes.
Okay. Now the main thing that you've been experiencing now with that low back and going into the left leg, currently you have the pain here and you feel it across the leg. Now how often do you get that radiating pain?
The radiating pain is probably about 3 times a month.
Okay.
I do work a desk job. I don't know if that has something to do with it, but...
Well, you're sitting a lot, I'm guessing. Okay.
And yesterday it just flared up really bad, driving up. We were riding up here and my lumbar was in the truck, so it got numb down there.
Okay, so you do get, it's numbness going all the way down into the feet, like into that?
Yes.
Okay. Mm-hmm. Okay, so that's primarily her main complaint, which 3 times a month with getting, that low back, left-sided, and into the foot. Now it's always the left side, correct?
Yes, left side.
Okay, and what do you currently do to try to manage it right now?
Besides my medicine my doctor gives me, I just try to move my position, kind of rotate my leg. I'll get up, I'll try to walk a little bit to loosen it up.
Okay. And then what, is it like a pain medication that they give you?
Yes, they have me on my pain medication from my back doctor.
Okay.
And that's really the only thing that gets me through because I'm constantly in pain in my back.
Gotcha.
So.
Okay. So today what we're going to be doing, not only are we going to be doing that full body adjustment, but in her case we're really going to be looking for that root cause of the problem. Obviously, there's something going on that is constantly causing that pain in her low back, going all the way down, radiating into her left leg, and at times going into her foot with the numbing. So what we're going to be doing is, instead of just trying to help her get through the day with giving her, a pill or medication, we want to literally fix that problem, that underlying cause, so you don't even need that medication anymore. That is, that's the main goal of what we're doing here today.
That would be great.
Okay. So what I'm going to have you do, actually I'm going to have you stand up first. I want to go through some range of motion in that low back. Let me know if anything does hurt it.
Okay.
All right. If you're to bend forward at the waist, is there any pain with doing that?
Yes, right here.
Okay, along that left side?
Yeah, right there.
Okay, does it stay there? Do you notice it traveling down?
No, it's traveling down the back of my leg right now.
Okay.
It's down all the way down to my, oh yeah, it's all the way down.
Okay, all the way down. Stand up for me. Okay, so right there for it. Alright, and if you're to lean back like this, is there any pain when doing that?
It's on the left side, but it stops like right here.
Right there. Okay, so it's just a little bit more local with that one.
Mm-hmm.
Alright, if you're to come to one side or the other side, any pain when doing that?
I mean, it's uncomfortable this side, but...
No pain, really?
Mm-hmm.
Okay, and then to the other side?
Oh, yeah.
Okay, so
right here, and now it's like a burning sensation.
Okay. So all that side. Okay. And then if you were to just rotate, any pain with that? Or any pain with that side?
If I go this way, it actually is a little bit on this right here, but not this side. If I do it this way, it doesn't hurt. But if I do it this way, it does right here.
Okay. All right. I am gonna have you first lay on your back for me.
Back.
Yep.
Right.
Okay. So we're gonna go through some orthopedic tests. I'm just gonna raise this leg up. Is there any pain in the hips or the low back I'm doing? Yep.
Yeah, right. Yeah,
Okay.
that's just the muscle, I think.
Is it more just the hamstring tightness?
The hamstring.
Okay. All right. So I'm gonna just bend this knee, come down just like that. Any pain in the low back of the hips with that?
No, it's just a hamstring.
Just a hamstring. Okay. Same thing with this side.
Yeah, it's burning all the way up.
It's burning all the way up there? Okay. Let's bend this knee. Pain, I see it in your face. Okay, let's relax. Okay, so pain with those orthopedic tests, obviously, in the main is all on that left side, right where you were showing me. Okay. All right, what I'm gonna have you do, I'm gonna have you flip over and lay face down. Okay. So now, everything we're already noticing is right in through here, right along that left side. Let's go ahead, we're gonna start the full body adjustment. I'm gonna start with scanning from head going all the way down to toe. I'm looking for symmetry, so what I feel on the right or see on the right side, I want it to be symmetrical with on the left side. So when I start off in that cervical region here, I'm definitely feeling a little bit of tightness more on that right side. Now let me know if any of this is uncomfortable to the touch, okay? But yeah, now coming through the trap, so...
Ow.
Yep.
Yeah, right there.
Yep.
Where your finger is.
I was gonna say, that left side's actually feeling a little bit more tense than the right. Okay. So coming from that cervical spine into the thoracic. And we're gonna follow the thoracic spine all the way down. Okay, now we're getting into the lumbar spine. Okay, I can already hear you breathing differently, so you're noticing that pain in here, correct? Okay, so I'm not going to aggravate it. I already know it's there. Any pain over that right SI joint?
A little bit.
A little bit?
Not much.
What about directly over the sacrum?
No.
What about that left SI joint?
Yeah.
Okay, so as we can tell, main thing on that left side, up top here, we got a little bit more tension on that left side in that trap, and then some right side and neck issues up there as well. So let's go ahead. Oh, we're gonna check the leg length out. Let's see how her leg length is doing. All right, her left leg is pulling short, as you can tell on the pink fuzzy sock here. The left leg is pulling short. But all right, let's go ahead. We're gonna do the hypervolt, and we want to just help relax the muscles up here and especially through here. Okay. So here's where I know this is going to be sore for you. So we're going very light in that low back area. Alrighty, so yeah, that I know was a little bit intense, I know, especially for you in this region. Yeah, I could definitely tell. Okay, so I just wanted to scan up the body, just see how everything is looking through here. Now, this we're going to be doing the adjustments. It'll be a little bit lighter we're going to do. It's going to be a little bit lighter and a little bit quicker in speed when I'm going to do these adjustments through here. Just because I know you're going to have a little bit of muscle guarding when going to make that adjustment. But let's start all the way up here in the cervical spine, that cervical thoracic junction. Okay, which actually this feels a lot better now with that. Okay. There we go. We're going to drop down on that right side now at T3 here. There it was. Good. Okay. Okay, so now after clearing out that T1 and that T3, we're going to do the just that nice P to A prone adjustment. posterior to anterior adjustment here. What I'm going to have you do, take a deep breath in and exhale all the way out. Good. And one more time, deep breath in and all the way out. Good. Okay. Okay, so I first want to start off with checking the sacrum, seeing if it's more of a sacral issue. I know we're getting some lumbar involvement just because of pain up here, but I want to see on that SI joint if it's more sacrum or ilium here. So I'm going to stabilize on the sacrum. I want you to raise this leg up as high as you can for me.
Oh.
And I heard already a cavitation. Relax. So that one does go up pretty high, but is there any pain, tenderness with that?
I mean, just a tender hamstring, you know.
Okay. And I want you to raise this left side up for me.
Oh, yeah.
Same thing almost with both of them there.
Yeah, this one's burning.
That one's hurting?
Yeah.
Okay. So this left side is hurting. Okay. So what I'm going to do, we're going to do the torquing job here. So it's happening. It is. So the good thing though, in your case, both your legs are going up. Pretty similar in height, which is a good thing. You're having a little bit more pain on that left. So I do want to do a few jobs on the left side so we can clear out any issues between that ilium and the sacrum on that SI joint.
Okay.
And then I want to focus on the lumbar spine from there.
Okay.
So I'm going to have you cross your left foot over your right. Yep, just like that. Yeah, you can do it. Just like that is good. I'm going to have you just scoot a little bit down. Perfect right there. I'm telling you, to come up from below. So I just want to test the tension of the table first. I don't want it to be too heavy or too light. A little bit more. There we go.
Oh.
Good. I told you these are going to be quicker in here. Good. Uncross and bend this knee. Good. And one more. There we go. Okay. So we just put a lot of movement into that area. Raise that left side up for me this time. How does that feel?
Oh, that feels good.
Good. That feels good. That was real quick that time. Alright, good. So what I want to do, I want to come down here and we want to check out her leg length. So actually what looks good is they're looking very balanced now. So that was one of the main issues, even with just balancing the leg length down, was that SI joint more on the left. Now when I push in, how does that feel even?
It's still tender, but not as bad as it was.
Not as bad as it was? Okay, good. Now how's it feeling even in through here? Because I haven't done any adjustment yet in that lumbar spine.
It's still tender, really tender when you press right here.
Right
there.
Right there. Okay. So what I'm going to have you do is I'm going to have you lay on your side and face me. Whoop. So I'm going to bend that leg. Good. Good. You're perfect. Come a little bit closer towards me. Good.
Oh, that's good. That feels so good.
Alright, I'm going to have you flip to this side and face me. I'm going to keep that bottom leg straight, top one bent. Good. Perfect. And lay flat on your back for me. There we go. Relax this leg. Good. Alright, I'm going to have you come on up Sit forward. Good. Okay. Dang, that's a lot better now. All right, good. So what I want to do, I want to make sure that the rest of the thoracic is cleared out. So let's have you stand up first. And I'm going to have you face that way for me. Good. And hands up and over mine. I'm going to have you lean back onto me like trust fall. Good. And squeeze your elbows together. Good. Perfect. Got a little one in through there. Okay. I'm going to have you take a seat for me and face that way. Okay. How's that left side feeling?
It feels good. I'm still having just a nerve pain right through my back of my leg, though.
Okay.
Right here. I mean, but it's not going all the way down my leg.
It's not going all the way down? Okay. Yeah, so at the end, I want to do a little soft tissue work on it.
Okay.
And then also when I do that Y strap, you'll feel that up in that occiput going all the way down as well.
Okay.
So let's make sure everything is cleared out throughout the thoracic spine. So I'm going to have you give yourself a big hug. Okay. Take a deep breath in and exhale out for me. Got it already cleared out. Perfect. So now I'm going to have you lay back. You can relax your arms. And actually, I'm going to ask for your help if you want to come in.
Yes, sir.
Just because your wife, she is a little bit lighter, what I just want you to do is just hold her just like that.
Yes, sir.
So we're going to be doing the Y strap here. And the Y strap, we're going to be doing that manual decompression. So I'm going to have you lift your head up for me. Good. And relax. Okay, so this is going to be from that all the way up at the occiput, going all the way down as well. So I'm just going to have you relax.
Oh, whoa. Wow.
Didn't I tell you?
Yeah, that was...
Relax for a minute. You felt how that just...
Yes, I did. That was amazing.
How far did you feel that go down?
I want to say all the way down.
All the way down? Okay, yeah. And the reason I had your husband hold you on, just because I know that you are a little bit lighter, I probably would have just pulled you right off the table up top. So I figured I'll just have him help stabilize you down a little bit.
Awesome.
Okay, I'm gonna have you come on up.
Okay.
Perfect.
Wow.
Alright, if you were to describe that to somebody who's never had the Y strap done, what would you tell them?
For one, it's amazing. If you don't do it, you're missing out. And it's literally like you just stretched me and put me back together. I don't know how to explain it. It's just, it feels amazing.
Right. Good. Okay, so what I want to do, I'm going to have you turn and face that way for me. So I wanted to do a little bit more, like I told you, soft tissue work on that left side. But you know what, actually, I'm going to have you lay face down, I'm sorry. That'll just be a little bit easier. So I'm going to do a little bit more tissue work on that left side. So now granted, what happened was, so when we remove the pressure off the nerve, what's happening is that pain that was all the way down in the foot, that nerve tends to travel back. So what's going on is she's getting a little bit, but she's not feeling that pain down in her foot. It's kind of creeping back. So I just want to help relax the entire area. We're going to take the massage device and we're going to go from that low back, that SI joint, and make our way all the way down to the bottom of the foot, just so we can help relax this entire area to help speed up that nerve, kind of that irritation, and relaxing everything here. So now even with this, does this feel different now?
Yes.
From compared to the first time, correct?
Yes.
Okay. The first time when I was doing this, it was actually, I could tell her body just kind of like clenching up and tightening up, just because it was actually more painful before. But what I'm going to do is I'm going to follow that sciatic nerve path, and we're going to follow everything all the way down here.
Yeah, definitely right there where you're at, right there.
Right in here?
Yep.
So as you can tell, we're doing that low back. I'm going to help just relax a little bit of the hamstring here. We're going to go onto that lateral side, go more over that IT band, and we're going to follow that IT band down. Now granted, I'm just following that entire pathway of that sciatic nerve that's stemming from that low back and just going all the way down as well. So as you can tell, the area in here where she was really wanting me to push down and where she was really feeling a little bit of issue is right over the piriformis muscle, where that sciatic nerve can either travel under that piriformis muscle, over that piriformis muscle, or in some patients it actually pierces right through the piriformis muscle. So a lot of the times also, you know, with the radiating pain, sometimes you do have to look at a little bit more of the muscles and especially that piriformis issue as well. How does that feel through there now?
It feels good.
Okay.
Better.
Yeah, it could have been even a little bit of tightness on that piriformis muscle that could have been causing some of that pain as well.
Yeah, I'm not feeling it down the back of my leg anymore at all.
Good. Yeah, I'm just going to go through, do the calf, come down to the bottom of the foot as well, just so everything can get relaxed on that left side.
Are you watching on this?
Now this was where you're having pain?
Yes.
Okay.
Numbing.
Okay, the numbing was right in through here.
Yes.
Perfect. There we go. You're all set. I mean, you can fall asleep if you like.
I looked up and asked him, was he watching these? We have, not that one, but we have a massager at home, so
Good.
maybe he can do that sometime.
Yes, yes. Doctor recommended doing some low back massage device, especially starting in the lumbar spine and going down the left side. So follow going into the piriformis muscle, which is about right through here, and then going down, doing the hamstrings through the calves, and then even the bottom of the foot where she gets that numbness at. Is also a good way to follow.
That's so wrong getting your doctor to tell me.
Thank you.
You're welcome. If anyone is looking to ever schedule an appointment, you can go right to the website, drjosephcipriano.com, email, and we'll get you scheduled in. Have a good one, everybody.